What if the true essence of a nation's spirit isn't reflected in its towering landmarks or vibrant metropolises, but in the forgotten spaces where its most vulnerable silently vanish? In the depths of America, amidst discussions on borders and budgets, a quieter catastrophe unfolds. One that fentanyl has transformed into a relentless predator. This synthetic opioid quietly steals lives, further weakening communities already torn apart by inequality.
Politicians are pushing a punitive response that will only make homelessness worse. We need to get these people off the streets so they can start healing after years of trauma of living outside.
As we delve into this issue today, brought together by a shared concern for the policies shaping our nation, let's face this hidden toll how fentanyl targets the homeless, exacerbating a crisis that calls for more than just sorrow but urgent action. Through tales of loss and figures of grief, we'll trace its course and consider the steps that could lead us forward. Understanding fentanyl, the silent predator. To fully comprehend the crisis, we must first understand fentanyl, the potent synthetic opioid that has gripped the nation. Originally developed as a powerful painkiller, fentanyl is up to 100 times more potent than morphine and was intended for use in controlled medical environments. But when it falls into the wrong hands, it becomes a deadly tool. Cartels and street dealers commonly mix fentanyl into counterfeit pills and widely used drugs like heroin or cocaine, often without the user's knowledge.
Well, I've been stuck on this fentanyl for a few years now.
What could you say it's been like being a fentanyl addict?
Oh man, it's a roller coaster. You get your good times and your bad times, but then again, everything in life is like that. You know, jobs, what. But I would say it's a more intense roller coaster than
Even the smallest amount, as little as a few grains of salt, can result in a fatal overdose by halting the heart or shutting down the lungs. This makes fentanyl particularly lethal. It acts swiftly, leaving precious little time for intervention. For the homeless, fentanyl is often viewed as a quick escape from the harsh reality of daily survival. It's inexpensive, easy to access, and lethal.
That's the best way to describe it. It's like you're literally crawling out of your own skin. When you're dope sick, it's like you don't even want to live. You don't even think you're going to live. I just kind of got, wrapped up in it, by taking pain medicine. It just brought me down a dark, dark road.
Dealers mix it into drugs, carelessly turning a regular addiction into a deadly gamble. The outcome is a sharp rise in overdose deaths, especially among homeless populations. In Los Angeles, for example, overdose deaths among the unsheltered increased by 55% from 2019 to 2021, with fentanyl becoming the leading cause of these deaths by 2023. These deaths are more than just statistics. They are lives lost in a silent, unseen epidemic. The origins of this crisis trace back to the early 2000s, when opioids were frequently prescribed, flooding the market with highly addictive substances. Now, fentanyl crosses the border from Mexico, evading law enforcement and driving the crisis forward. In 2024 alone, the DEA confiscated over 55 million fentanyl-laced counterfeit pills, a staggering figure. But for the homeless, this is not just a border problem. It's a toxin that invades the most vulnerable corners of society. Fentanyl doesn't discriminate. It targets those with nowhere else to turn. In 2024, there were more than 87,000 overdose fatalities nationwide, many of which were linked to fentanyl. This is not simply a public health issue, it's a moral one. These fatalities serve as a reminder of how easily society can overlook its most vulnerable members and the deadly toll of that neglect. Fentanyl is a silent killer, and it's time to confront it directly. Heartbreaking statistics, numbers we cannot ignore. When the noise of political debates subsides, the harsh reality of our nation's overdose epidemic becomes undeniable, particularly when we take a closer look at the numbers, which expose the devastating impact on the homeless. These aren't mere figures, they are lives lost, families destroyed, and communities in turmoil. Drug overdose deaths have surged over the years from 16,849 in 1999 to a staggering 106,699 in 2021. While there's been a slight decline recently, the crisis is far from being resolved. For the homeless, though, the situation is even worse, with dangers often overlooked by those in power. In Los Angeles County, over 2 to 500 homeless individuals perished in 2023, with 45% of those deaths caused by drug or alcohol overdoses. Fentanyl was a major contributor found in over 70% of those cases. The overall homeless mortality rate remains shockingly high at 326 deaths per 100,000 people, despite a plateau in recent years. From 2019 to 2021, this rate spiked by 56%, and communities are still reeling from the loss. Similar patterns can be seen nationwide. In King County, Washington, overdose deaths among the homeless surged during the pandemic, with the death rate vastly outpacing that of the general population. In Santa Cruz, California, 42 overdoses resulted in 26 fatalities, underscoring the severe addiction crisis among the homeless. While there is some hope with overdose deaths dropping by 24% alone nationwide in 2024, this does little to ease the suffering of the homeless. Studies indicate that for every 1% increase in homelessness, drug-related fatalities rise by nearly the same percentage. The homeless are especially vulnerable to fentanyl, which is cheap, readily available, and often mixed into other substances without the user's awareness. These numbers reflect a failure to tackle the underlying causes of homelessness and addiction, such as underfunded mental health services, a lack of affordable housing, and the opioid crisis. The homeless crisis is a direct result of systemic failures, and it's a pressing issue we can no longer disregard. Personal stories, faces we have forgotten. In every thoughtful reflection on the state of our nation, there comes a time when the cold statistics and policy discussions give way to something more tangible faces. These are the individuals whose lives have been shattered by fentanyl, a drug that transforms personal battles into devastating tragedies. Their stories remind us of the human cost behind the headlines. Take Chris Tawanu from Portland, Oregon, as an example. At 18, Chris was beginning to rebuild his life, finding housing through a nonprofit and re-enrolling in community college. But just as his future seemed bright, fentanyl took it all away. Having aged out of the foster care system and then faced the isolation of COVID-19, Chris became a victim of fentanyl's silent hold. In December 2023, his passing was mourned during the Houseless Day of Remembrance, a ceremony honoring young lives lost to homelessness and addiction exacerbated by the pandemic. Not far away in Los Angeles, Michael Flores lived in a tent on Etna Street, struggling to survive. His temporary housing under Project Roomkey was a small reprieve, but his escape came in the form of fentanyl, his pill of forgetting. He used it to numb the pain of untreated health issues, but it ultimately claimed his life in 2023. His death was one of many in LA, where over 2,500 homeless individuals died that year. Friends remembered Michael for his quiet humor and his dreams of a better life, but fentanyl ended that life prematurely. Then there's Ronald Paul Hams, a veteran who spent his days on Skid Row helping others by administering Narcan, saving over a dozen people from fentanyl overdoses. Yet even Ronald couldn't evade fentanyl's destructive grip. He lost family and friends to the drug and saw firsthand how it tears apart communities. His work, though heroic, revealed a painful truth. Fentanyl doesn't just take lives. It destroys relationships, leaving people isolated even in death. These stories offer a glimpse of how fentanyl preys on the most vulnerable, those with untreated medical conditions and those trapped in dire circumstances. From the heart disease that took Angeline Swan and Van Nuys to the countless others caught in the clutches of addiction and despair, fentanyl weaves its devastation into the fabric of homeless communities. These individuals are not just statistics. They are sons, daughters, veterans, and neighbors. Their lives matter, and their stories compel us to ask deeper questions about the policies that have allowed this crisis to continue. Societal impact, the spiral of isolation and violence. The effects of fentanyl extend far beyond individual lives, disrupting entire communities and placing enormous strain on public systems. It's not simply a personal tragedy. It's a destructive force that amplifies isolation, fuels violence, and burdens society in ways we cannot ignore. In cities such as Portland and Los Angeles, where homeless encampments are prevalent, fentanyl intensifies the isolation of the most vulnerable. People withdraw into themselves, using drugs in isolation, whether in motels or beneath tarps, severed from the support networks that once existed in these areas. This isolation, further compounded by the lingering effects of the pandemic, often leads to unnoticed overdoses with no one around to administer life-saving interventions like Narcan. As fentanyl's hold strengthens, it establishes a destructive cycle of hopelessness. Petty crimes like theft escalate into violent robberies driven by the unrelenting need for drugs. In regions like Oregon, where youth homelessness is on the rise, fentanyl has only intensified an already unstable situation. Social spaces that once offered connection and support are either overwhelmed or closed, leaving young people stranded without assistance. The impact of fentanyl stretches beyond the homeless, seeping into public systems and the broader economy. In places like Hennepin County, Minnesota, emergency rooms are flooded with opioid-related visits, many of which involve fentanyl. This puts immense pressure on healthcare resources, shifting the focus from long-term care to managing immediate crises. In Los Angeles, homeless individuals are 38.9 times more likely to die from a fentanyl overdose than those with stable housing. The financial burden is overwhelming, with billions spent on clearing encampments and funeral services funds that could have been used to address homelessness through affordable housing initiatives. Beyond the economic strain, fentanyl erodes trust within communities. In neighborhoods hit hardest by homelessness and addiction, residents feel unsafe, businesses close early, and trust between neighbors diminishes. This isn't a collection of isolated incidents. Data shows that as homelessness increases, so do drug-related deaths, highlighting how fentanyl tears apart the very fabric of communities. The critical question remains, why do we continue to treat fentanyl as separate from the broader issues of inequality and lack of access?
There you go.
Until we address these systemic problems, the cycle of suffering will continue. Root causes poverty, lack of support, and the black market. At the core of the fentanyl crisis affecting America's homeless population lies a more profound set of problems: poverty, lack of proper support systems, and a black market that exploits the most vulnerable. This is not a random disaster, it's the consequence of years of neglect and systemic failures. The crisis stems from economic inequality, where stagnant wages and rising rents push families to their breaking point. Once at this edge, the temptation of inexpensive drugs like fentanyl offers a fleeting escape from the harsh realities of daily survival. In states like New York, opioid-related deaths surged during the isolation brought on by the pandemic, with poverty and unemployment significantly contributing to this rise. Evictions only escalate the crisis, as for every 1% increase in homelessness, drug-related deaths follow suit. Landlord-tenant laws have become more volatile, forcing people onto the streets where fentanyl is readily available and used as a coping mechanism. Mental health issues, which often go untreated, are another major factor in the problem. Many individuals self-medicate with opioids to manage their struggles, but the mental health system, burdened by decades of underfunding, cannot provide the necessary care. Compounding the crisis is the black market, where fentanyl enters the country in massive quantities. Transnational drug cartels ship fentanyl precursors, which are then processed into a product far cheaper and more potent than heroin. In 2025 alone, over 55 million fentanyl-laced pills were seized at the southern border, underscoring the scale of the crisis. This affordable and easily accessible drug infiltrates communities often mixed with cocaine or methamphetamine, leading to fatal overdoses in cities like Baltimore and San Francisco. The black market's influence is magnified by the failure of our healthcare and justice systems. Pharmaceutical companies oversupplied opioids in the early 2000s, creating a demand for illicit drugs that continues to affect communities today. The criminal justice system, which cycles drug users through prisons rather than offering treatment, only exacerbates addiction. In areas like California, youth aging out of the foster care system face a lack of support, resulting in higher rates of addiction and homelessness. Fentanyl flourishes in this environment of inequality and neglect. It's a symptom of broader societal issues that prioritize punishment over prevention and care. Yet even amidst this crisis, there are signs of hope. By addressing the root causes, poverty, inadequate support, and a flourishing black market, we can begin to reclaim lives and break the cycle of addiction and homelessness. The path forward requires a shift in focus from containment to sustainable solutions. Solutions and Hope, Action Today. As we reflect on the fentanyl crisis among the homeless in America, it's time to move beyond diagnosis and focus on real, effective solutions. Hope isn't just a far-off ideal. It's found in evidence-based strategies that can bring about change today. One of the most powerful tools in this battle is naloxone, a life-saving medication that reverses opioid overdoses. In areas like Maricopa County, Arizona, public health campaigns distribute naloxone alongside fentanyl test strips, helping users identify the drug before it's too late. This method has already reduced emergency visits and saved numerous lives. Another vital solution is expanding access to medication-assisted treatment, MAT, such as buprenorphine and methadone, especially in outpatient clinics serving the homeless. When combined with counseling, MAT addresses addiction at its root and improves long-term recovery rates. Programs in cities like Portland have successfully implemented these treatments, stabilizing youth who have aged out of foster care and assisting them in transitioning to a more stable life. On the policy front, states like California are leading by example with comprehensive plans that merge law enforcement with harm reduction. California's master plan has resulted in a significant rise in fentanyl seizures and a major investment in recovery beds and peer support networks reaching people where they are, on the streets, not behind walls. At the federal level, the Substance Abuse and Mental Health Services Administration is funding community mental health programs that provide culturally sensitive services to the homeless, tackling issues like co-occurring mental health and substance use disorders. Grassroots initiatives are also crucial. In areas like Skid Row and Hennepin County, street medics and community coalitions offer direct support to those in need, distributing Narcan and providing prevention services. These local tailored efforts have proven effective in reducing fentanyl deaths and empowering communities to take action. For the homeless, where fentanyl and methamphetamines often intersect, a comprehensive approach that addresses both opioids and stimulants is essential. The key is acting today, distributing naloxone, advocating for housing first policies, and supporting peer-led programs. These efforts are already helping to decrease deaths and restore hope for those at greatest risk. Break the cycle. As the echoes of these stories and statistics fade into the growing darkness of our discussions, we stand at a crossroads faced with the choice to let fentanyl's hidden cost carve deeper into the heart of our nation, or to rise with the steady resolve of those who have found redemption amid devastation. From the face of the predator to the origins of despair, we've followed a journey of immense loss, yet one illuminated by tangible hope, harm reduction strategies, policy shifts, and the strength of community support. The homeless in America, burdened by this crisis, remind us that the true measure of our nation lies in repairing what's broken, not simply mourning it. Let this be our pledge. Share your commitment in the comments below. Donate to organizations like the National Alliance to End Homelessness and subscribe for future discussions. Together we can break the cycle, not tomorrow, but today.